and do not reflect the opinions of In Touch Radio or its staff.
Okay, all parties. Wait, did we lose? Get ready, get ready, get ready. It's less, this is a test. Let's see, do we have all parties?
We're waiting on Commissioner Myers.
Well, she was actually on, I think, unmute, Commissioner. I show that she's on. I mean, we have a couple of minutes before the show.
Again, I apologize that I'm on like my headset and my phone. I
Hey,
couldn't get my.
You're absolutely perfect. How you doing, Doc?
Good. You guys doing all right?
I can't.
Yeah.
Staying safe. Staying safe.
Good. Yeah, that's all we can do. Stay safe. Stay covered. Stay well. I don't. Who knows? And you never know where you're going to pick this up, right? You feel like you can maybe let your guard down for a second, and lo and behold, you get sick. So who knows?
Well, listen, guys, it's showtime. So get ready, get ready, get ready. And if you're not already ready, you should be ready, because it's Special Business with Cheryl. And I'm here with my co-host, the second hour of the show, but we're doing two shows, the second and the fourth hour, because of where we are as a community and where we are with COVID-19 and the Delta variant.
Indeed.
This is the show where we will be all up in your medical business. And we have two in the house today. So first, we want to take the opportunity to say a huge thank you to our medical and that of the Moffitt Cancer Center, with a message, a lasting commitment to the prevention and cure of cancer. Thank you to our Moffitt family for supporting us and helping us to bring awareness to Let's Talk Business with SJC and Dr. Shanae Davis when it comes to the medical plight of our community. And it's just so prevalent today that we have these experts on. So we have two special guests, and I'm checking to see if all are in place and ready to go. Is here, and she's going to facilitate the entire show. But let me go ahead and there you go. Thank you, Dr. Carlos A. Smith. We see you are ready to go. Checking in with Commissioner Gwendolyn Myers.
All right, Commissioner Myers is here. I hope you can hear me.
There you go. We got you. You are unmuted. Thank you so much to both of our guests. What we're going to do is go ahead and introduce to our radio listening audience, to those of you who are joining us on Facebook and taking your lunch break with you. We thank you. We thank you to our In Touch family, our YouTubers for joining us. Those who are seeing the show today, please like and share. And if you're joining us later in the day or over the weekend, we appreciate that you do the same because of the information that our two guest experts will be sharing with you. Now, August is also a super special month because it is National Black Business Month, and we certainly want to celebrate our Black-owned businesses. You know that August brings to us 31 days, and with that, we always give you 31 days to support a Black-owned business by spending, look, $31 plus. I'll talk about my two before I drop the mic. And I'm so excited, Dr. Davis, that I had two of my colleagues, well, one in particular that wasn't doing well. And I said to him, well, what do you feel like eating? And he wanted some seafood. So I headed over to the Fish Company, our friend, advertiser, colleague, Marvin Knight, and he hooked my friend up the final seafood platter. So when I checked in again, my friend appetite picked up and he wanted some soul food. And we wanted to make sure he had some soul food so he can pick on a couple of extra pounds. And for that, we went to the Open Cafe. And Florence Gaynor over there hooked him up with the rice and smothered turkey wings and all that came with it. So we're shouting out those two Black-owned business today in celebration of National Black Business Month. So welcome all to the show. A word from you, Dr. Davis, before I delve into the introductions.
Absolutely. Hello to our very special guest. Special thanks to you, Commissioner Myers, and also to you, Dr. Smith, on the front lines of this all as we, try and do what we can to impart some great information in our community. COVID-19 has come back on us, just as we thought that we were going to get back out and be able to take our mask off and enjoy, life as we knew it in 2018, 2019, here it comes again. So today's special guest, our county commissioner, Gwen Myers, and our physician on board, a physician at the St. Joseph's Emergency Room, they're going to talk to us about how this new variant, this Delta variant, has affected our communities, talk about, vaccine resistance, how is it that we can just use maybe some mask wearing and social distancing, and what else can we do to try and prevent, from being infected, and also talk about how it's different now than it was just last year. So as we, impart on this information on our communities, trying to stay safe, trying to stay healthy, these experts are going to tell us some ways to do that. So I want to just do a brief introduction of who we have here. Dr. Carlos Smith is a board certified emergency medicine physician who's been practicing at St. Joseph's Hospital here in Tampa since 2005. As an ER doctor, he is truly on the front lines of our local fight to eradicate COVID-19. Health stability, risk, and aptitude evaluations fill his daily routines, not only as an ER physician, but also in his role as a team physician for one of our local professional athletic teams, and also a neurotrauma specialist for the NFL. In addition, he serves as the medical director for JET ICU, which is an air ambulance service, and also the Bay Area Humanity Medical Clinics. He is a graduate from Jesuit High School, so truly a local, and also FSU, Florida State University, Go Noles, and St. George's University School of Medicine. He completed his emergency medicine residency at Wayne State University in Detroit, so he truly understands how different communities and various people may present to the emergency room, and has a lot of experience to impart on us today. Commissioner Gwen Myers is a lifelong native and resident of Hillsborough County. She was elected to the Board of County Commissions in November of 2020. Before being elected, she has served in our county government for 25 years, from the year 1988 to 2013, with the housing, communities, and the health and social services areas here in Hillsborough County. She has a BA from Florida A&M University, Rattlers, special to my heart. I'm a Rattler myself. She's also married to Randolph T. Myers, Senior. Her theme that she practices by is, that guides her, is it's all about the people. She has a special interest in transportation, affordable housing, and the healthcare of our community, and some initiatives that she's going to talk to us about today. So without further ado, I'd like to give our special guest an opportunity to speak and welcome our and introduce themselves to our audience and what it is that they do. Dr. Smith.
Yes, thank you. Thank you so much, Dr. Davis, for having me. Truly an honor to be here to speak on behalf of the and what we're actually seen here, and it's not only here at St. Joseph's in Tampa. I mean, it's not unique. It's ubiquitous. It's throughout. Yeah, like you said, we were hoping that we would get back to life at 19, but unfortunately, the Delta variant has proven us wrong. But we're in this daily struggle. We evaluate, we treat individuals, and we have thankfully we have medications that we did not have back in 2020, early 2020, when this all happened, when this all commenced. So thankfully, our medical management of these patients are actually, we're seeing a lot better results from it. So we're in this fight. We'll continue to do what we need to do in order to make the public health a priority and safety again. So thanks again for having me.
All right. So Commissioner Myers, so we've titled this show to our audience, The State of Our Community. So what is going on in the County Commission to combat COVID-19 and increase awareness?
First, let me say thank you for having me. If you can turn your camera on, I have my camera on, but I'm not shown on the camera, so I hope you all can see me and hear me.
We cannot, we cannot, Commissioner. Is there
My
something
camera
blocking
is
your
on.
camera?
My camera
Okay.
is on. Yeah, my camera is on my end. But anyway, let me just say that it's good to be here and share to the community regarding COVID-19 and what Hillsborough County government is doing. We all know that the COVID-19 was last year, and this Delta variant is a super monster, I would say. It has a fear that making everyone think twice what to do, hold back, or not get a shot. But we want to reverse that in Hillsborough County. We're saying that you have a testing site you can go to. We have 4, all in District 3, okay? If you want to go get a shot, vaccination shot, you can go get that too in Hillsborough County. So the Hillsborough County government is leading in COVID to make sure everyone that wants a shot, they can go to one of our facilities. Or if you want to go be tested, there's a facility near you where you can go and be tested. But we don't want you to all just be tested. We want you to get the shot. We want to stop this spreading of the Delta virus here in Hillsborough County.
Absolutely. Let me ask this of you, Dr. Smith. Commissioner Myers says that there's some resistance, in our community. Who's coming into the emergency room with, symptoms of COVID-19? And if they are fortunate enough to leave without a diagnosis, of COVID, what kind of advisement do you at the ER afford them?
Well, we certainly are seeing, now that there's been the advent and administration of vaccines, we know the 3 different types of vaccines that are out there. Most of our diagnoses of COVID-19 are patients who were not previously vaccinated. The grand majority, as a matter of fact, that are having a new diagnosis of COVID-19 are non-vaccinated. However, having said that, like in anything, we are seeing some symptomatic patients that come to see me in the emergency department that truly have been vaccinated in the past, with actually all 3 of the different vaccines. We are seeing more prevalent with a couple vaccines versus another, but still, and it just goes to show you, vaccines are great. They're great. They're great. They're great. And I'm an advocate for them, but they're not 100%, just like everything in medicine, right? So we even see that with the flu, the yearly flu virus. Most of us get the flu vaccine, and some of us still get the flu. So, but to answer your question, the by and large, the majority are non-vaccinated, and those that are not vaccinated and that they do have COVID-19 and they are fortunate enough to be discharged, I certainly advocate for vaccines once they convalesce and they get better and 3 months go by without any symptoms. I'm certainly an advocate for vaccines. I will tell you that my wife was the one who pushed me into getting the vaccine. I was a little cautious and apprehensive with the vaccine when it first came out, but kudos to my wife who pushed me in the right direction, and I certainly think it was the right idea. I feel safer in the emergency department with my vaccine, and I will go forward with telling everybody I think it's time for you to get vaccinated. So that's basically what we see. I'm on at 2 p.m. today, so I'm sure I'll have this discussion multiple times today.
Absolutely. I think that's great that you said that, Dr. Smith, that you were a little vaccine hesitant yourself, being an emergency room physician. Commissioner Myers, we see a lot of that in the African-American community. At some of the sites in your district and around the county, what is some of the feedback of our community residents regarding their hesitancy to get the vaccine? And what are we doing to overcome that?
Thank you for the question. The feedback is, just street talk. It's not for me. I get it later. Street talk. Not realizing how COVID-19 and the Delta variants have affected the individuals' lives here in Hillsborough County. This is something that we cannot wait for and make a decision on. And so what I have done as county commissioner is led the way in Hillsborough County to make sure that the African-American community partner with the churches, civic organizations, to make sure they have a place to go to receive the vaccination. That is the most important thing. In Hillsborough County, we cannot say the Black and brown people have been overlooked. No, we have not. We leading the way in many other counties to make sure African-Americans have a place to go, be tested, and to get a shot. One of the things that I'm encouraging people to do, just think about when we were in elementary. So you need a vaccination to go to school. Mama said, we need to take you to the health department to get your shot. We went, no questions asked, didn't even know what was in the shot. But in order to be enrolled in school, you went and you got a shot. Well, today, we're a little grown, a little sassier and all that good stuff too, okay? But you need to get the shot. Just last night, around about 5:30 a.m., I lost one of my colleagues from COVID, okay? Just last night, hurt me to my heart. Each other's wedding, went to school and all, and he had the shot. He had the shot at my church. Last one, the second shot he had taken was on February 14th. And so I cannot stress enough what the African-American community is doing and how we're partnering with our churches and me leading the way as a commissioner to make sure. I just had the last one at New Mount Zion about 2 weeks ago, and on Facebook, just pleading with our community to come out. We find time for everything else, okay? And until it hits home, when I say hit home, meaning you see mother suffering, father suffering, sister or brother, now you're ready to run to get the shot. But you shouldn't have to witness that in your family before you decide to go get a shot. Totally. So I just encourage the African-American community. This is one time that we can say we're not left behind on getting the vaccination. We're leading the way, and we just need to make sure more African-Americans that have not been vaccinated come on board and get the shot.
Absolutely. In some of the other states I've seen on social media, just the most unique, outreach campaigns to just try and target those that have been, pretty resistant. Commercials, cartoons, even Juvenile, they have that song Back That Thing Up. They have a new version. Someone paid them to make a Vax That Thing Up song, and that's out there. Just all the different ways of trying to just increase energy and awareness and hype around getting the vaccine, specifically in our communities. Everyone needs it, but these have been ways to target African Americans. Dr. Smith, I would love for you to comment on a few things. African Americans, with COVID infections, had greater morbidity and greater mortality and greater chance of infection last go round. We're still seeing, those similar outcomes, but there's not as big of a disparity just because it's amongst, just unvaccinated people altogether for other reasons. But why is it, can you explain to us why you believe that African Americans have such greater morbidity and mortality when it comes to COVID infections? One, two, talk to us about why we're seeing so much breakthrough. What's different with this Delta variant that's being able to get through the vaccine shield, essentially?
Well, in regards to the greater morbidity, mortality of the African American community, I'm not quite sure. I'm really not 100% sure. I don't know if it's because they have other comorbidities, like we were saying, whether they have COPD or end-stage renal disease, hemodialysis, diabetes. I'm not quite sure if anybody really knows at this point why there is a disproportionate amount of African Americans who are doing poorly with the COVID-19. So I don't know that. I don't have an answer for that. In regards to the Delta variant, everybody says it's highly more contagious as the other variants were, and I also think it's just because everyone's more laxed. I gotta say, I'm more lax too. Being perfectly honest, I know I wear my mask less often when I'm out and about with this Delta variant as compared to when this first came out early 2020. I don't know if, I had COVID. Actually, I had COVID in November of 2020. Thankfully, I had a very mild course. And so I had an extremely mild course, and then I got my Moderna vaccine. And so sometimes I feel like I'm a little not immune, but I kind of feel like I would do fine. And I think this is what's happening with everybody, is that we're all kind of we're sick. We're just we want to carry on, like you said, Sinead. 2018, 2019, we kind of want to get back to it, and we're all kind of tired of all the restrictions that we've had to do. So I think we've become more lax, and I think that's why we're seeing a rise. That's why we definitely are seeing a rise in the cases once again. So my wife and I were just somewhere earlier today, and she wore her mask and I didn't, and she asked me, "Why are you not doing it?" And for me, I'm like, I just didn't put it on. So I'm just being frank and honest, even though in the ER, I wear it mostly. I can't say it's 100% of the time, but I consider myself more cautious in the emergency department for obvious reasons than I am as compared to going to the grocery store or wherever it may be. So I think that's why we're seeing it, is because people are just fatigued.
And that's an important point, especially when it comes to the way people fellowship. And I know that Commissioner Myers can talk about, some of our community events that we're doing, like, back to school, functions, or picnicking, or, church functions, or what have you. The way people fellowship and in the proximity in which they fellowship, it's, it can be a risk factor, particularly if you're not wearing masks. Our vaccines are protective, but it's very important to continue to implore those non-medical things, the social distancing and masking up when we can. So to you, Commissioner Myers, we're going back to school. People are getting on the bus. Our kids that are under the age of 12, they aren't eligible for vaccines. Our schools are seeing an increase in children that have to be quarantined. Some teachers that are not vaccinated are showing positive cases of COVID. And they bring the virus home to people that are unvaccinated and to other children. What can we do to push this word out? I know you've said that some things are going on in churches, but how are we able to convey this message outside of the church? What is the county doing? What else is going on to increase the message?
Well, one of the things the county is doing, we're looking right now to see if we're going to come up with a mandate for our employees to be vaccinated. We know we have some religious issues with some, and perhaps with others, medical, but it has come to the point now everyone needs to be vaccinated. I'm pretty sure most heard this morning, the city of Tampa has led the way in the region to make sure that giving them to October 1. I was talking with another employer the first of the month. They ended up firing about 12 employees. They gave them the ultimatum to get vaccinated, or you won't have a job. And so I listened to Dr. Fossey a lot of what he has said when it's going to spike and all. And now he's telling us we might can get out of this Delta variant and things might look a little bit better spring of next year. I truly believe him as a scientist, the leading scientist for America. And we cannot continue to put other people's lives in jeopardy. I know for the young people that are going to school, even them, they have on a mask, okay? And I just listen at the parents battling back and forth. And I've said to other elected officials, we are elected to lead. And we have to make the best decision for our students, okay? You say you want our students to get an education. We don't want them all home quarantined and can't come to school. So let's just do the right thing, mask up, go to school, try to get an education. But only way we're going to get through this, we have to work together. The social distancing, washing your hand and putting your mask on, it's not going to hurt you to wear your mask. I wear mine all the time because I just want to be protected. I'm tested every week, okay? A lot of people don't have that opportunity to be tested every week, but we have the opportunity every day to wear a mask to protect yourself and to protect others. And then to take it a step further, we even go to the extent about, we want to be paid to go get the vaccination. Well, that's your health. Your health should be the most important part if you plan on staying on this earth. So I'll just leave it there and I'll come back to continue to talk about why we should not pay people to get the vaccination.
So I want to play devil's advocate here because I know that there is now a tax break for employers to actually allow their employees to get the vaccine and do that in a paid fashion. So I totally understand, our personal beliefs. I actually have my own, but some, employers, particularly small businesses, can actually get a tax break if they pay, their employees to get that vaccine, if they give them that time paid to go get the vaccine. Our listeners may know that on yesterday, the 23rd, Pfizer became the first vaccine to get FDA approval. And Commissioner Myers, you were saying that many in the city are now, and other businesses can actually now mandate that the vaccine be taken and it be a condition of employment with the with this FDA approval. So that's good to know for our audience that that's a requirement of our city now. But again, in playing devil's advocate here, sometimes if you truly believe that you shouldn't wear a mask, if you really don't want to be vaccinated, just like, being inside can give you mental health issues, being alone, having to do this, having to do that can, be stressful and cause strain. What can we do to not pressure people, make them feel bad to get a vaccine? If people are feeling pressure to get, the vaccine, what can we do not to make them feel bad? That messaging has to be a bit more neutral. And I'm just, playing devil's advocate here. So Dr. Smith, talk about some of the mental health issues that come about in the ER with the strain of, having to be vaccinated.
Well, I think everyone's got this country is great because we have freedom of choice, right? So I give my opinion to get vaccine, but I also honor their, the rights not to do it. I mean, we've with the flu virus, with those vaccines. I don't browbeat anybody who chooses not to, and it's their choice. But yeah, we do we see mental strain when it comes to the whole COVID thing? Absolutely. Our psychiatry evaluations, psychological evaluations have gone through the roof. Our Baker Acts have gone through the roof. We're all feeling the strain, and whether that's because they're feeling alone, quarantined at home, and they finally come out and they've lost touch with reality, whether an infection has caused them to, or infections have caused them to lose family members, and they've got, they're melancholic, they're depressed, they're suicidal. I think we've run the gamut with psychological stressors when it comes to this virus, whether it be they got infected, they were quarantined for years. I had a patient probably about 2 weeks ago that hadn't been out in probably a year from her house. And so it's almost kind of like she was a hermit, and she said it. She's like, I was going crazy at my house. So I think we've seen a lot of psychological strain with this pandemic. And I see it in the emergency department as these patients come in for psychiatric evaluation. So it's been unfortunate.
So with that, I want to take a quick pause for the calls. We want to give our sponsor an opportunity to let us know what's awesome about everything that they're sponsoring here. So after the quick break, we'll come back and talk about what we can do to curb this pandemic and further increase information and access.
Cancer affects everyone, but minority populations are often hit hardest. Moffitt Cancer Center is working to address the barriers that keep some groups from getting the care they need. African Americans develop cancer at a younger age, have more aggressive cancers, and experience worse outcomes than the general population.
While cancer treatment is evolving with precision medicine, who is being left behind? We know for many decades that some groups experience a greater burden of cancer than others. We can prevent it, we can detect it early. It's very beatable when we find it early. I have worked with cancer patients during their treatment. All cancer patients have courage.
So my treatment was about 18 months. I had 3 cancers and 7 surgeries. But my son told me, like, Mom, you're the strongest person that I know. Moffitt saved my life.
During COVID-19, Moffitt is a safe place for your cancer care. Call now to schedule an appointment.
Catch my show that will be all up in your business. Let's Talk Business with Cheryl J. Cuso. Every Wednesday at 12:31 p.m. My business experts provide insight for business entities and entrepreneurs. So join us every Wednesday from 12:31 p.m. to 1:31 p.m. at www.intouchnews.com. Catch my show.
All right, get ready and we are back. Have a little bit of an echo and they're going to fix that. Thank you very much. So with our COVID-19 Delta variant infections, we're seeing more in children now because the Delta variant is just much more infected. So to Dr. Smith, I want to pivot a little bit. Talk about what's different in the presentation of COVID from last time to this time, and how are we seeing these COVID infection symptoms in our kids?
I'm sorry, I lost you. I'm sorry, Dr. Davis, can you repeat the question?
Absolutely. I said we're going to pivot a little bit and go pediatric, okay? We're seeing more children now be infected with this Delta variant of COVID-19. Talk about how they are presenting and if there's any difference in how the children that are infected now are presenting than they had before. Tell us about that.
So, and I got most of it. I'm having technical difficulty. So full disclosure, I'm an adult ER physician, but obviously there are kids in the in the pediatric emergency department at St. Joe's, and I think a lot of them are presenting the same way that adults are. I mean, I think it's cough, cold, congestion, but not all the time, right? Just GI complaints, nausea, vomiting, diarrhea, abdominal discomfort. They can all present that same way. I know kids are doing largely well, better than adults. I know our admissions in my hospital system are just a small percentage of COVID admissions. So kids are doing largely well. I think Dr. Davis, she did mention, vaccine, and it's only Pfizer, still not indicated for really small kids, but hopefully that's going to change. Hopefully the science is there that will support that we can vaccinate our children. So if they do less, so kids are largely presenting the same as adults. Obviously, is just a very small percentage, the minority of cases. So I hope that answers your questions. Like I said, I was kind of losing you there with your question to me.
I hear you. So what you're saying, because there may be a I don't know, internet issue there. But what I've heard is they're presenting basically nausea, vomiting, diarrhea, and not much different from adult cases. But because they can't be vaccinated as readily as adults can, they're bringing these infections home. So Commissioner Myers, my question to you is, when you see a greater prevalence of COVID-19 in our areas, in your district, in our communities. There are now treatments for COVID, this monoclonal antibody treatment that, last year we saw, some of our politicians in DC on the news, they get, access to this, and it was a life-saving treatment. This is something that's of no cost. And our community just needs to know about it so that if a COVID infection does come about, we can actually survive it. What monoclonal antibody sites are available in your district or near your district? And what steps can we take to increase awareness of treatment for COVID-19 should an infection come about?
That's a very excellent question, because Hillsborough County just opened their site on last Friday, I believe last Thursday, when the governor announced that we had one here in Hillsborough County. So I'm pleased to share with your audience where it is located in District 3. It is located at 8008 East Chelsea Street in District 3 in Tampa, at the King Forest, the recreation facility. The good part about this with the antibiotic is you have to make an appointment. So it's not just drive up, walk in, and you can be seen. It's a referral from your doctor. So your doctor would know your condition, that you really need to get this antibiotic shot to help you because of your immune system and other health issues that you have. So I'm real pleased that Hillsborough County, we have one here now for individuals, serving about 300 people a day. And so that's really good that we can serve that many people in one day. So I encourage as many people that borderline thinking about it, you have some health issues, talk with your doctor, go online and register, and make sure you can get in. We're open 7 days a week from 9 a.m. to 5 p.m. at 800 East Chelsea Street in Tampa. And that's a site for Hillsborough County government.
Awesome. Dr. Smith, can you tell us more about that process? I understand that you all at the St. Josie are actually administer monoclonal antibodies?
Yeah, so I'm a big proponent, just as I am with the vaccine, for the monoclonal antibodies injection. I like I said, I'm going in today. I'm sure I'll give it at least a half a dozen times today. So I'm a big advocate for the administration of the monoclonal antibodies, not only in the emergency department, but I also think, in the community, as like the commissioner was saying. The only difference is in the hospitals that monoclonal antibody infusion will be IV, whereas in the community it tends to be what we call subcutaneous or underneath the skin. But we are seeing that even though it is not, even though the monoclonal antibody is given underneath the skin, it's still working just as well. So I'm a big advocate. I will try to, there are some people who don't want it, obviously, right? Just like people don't want to take a Tylenol or a Motrin or whatever it may be. There are people that don't want to take it. I try to talk them into it, but I respect if they don't want it. But the monoclonal antibody is doing wonders for those infected and those. There are certain, it's important to know that there are certain inclusion and exclusion criteria. Just because you have the COVID-19 doesn't necessarily mean you automatically get the monoclonal antibody. Symptoms have to be within 10 days. Symptom onset has to be within 10 days. At least in the emergency department, we're not giving it if it's greater than 10 days out. But we've really opened up the inclusion criteria because we know and we feel that the monoclonal antibodies help to hasten and quicken the resolution of all the symptoms and just the COVID-19 infection as a whole.
Okay, that's really interesting. You said it just hastens the symptoms, or it helps the COVID-19 resolve faster. What's the benefit of that besides feeling better? Is there a physical benefit to getting the monoclonal antibodies? I've heard of,
I'm sorry, go ahead.
post-COVID syndromes where there is extra fatigue, where there's mental fog, where there is extra shortness of breath, there is prolonged reduction in your olfactories or your sense of smell and your sense of taste. If there is a difference in the recovery for patients receiving monoclonal antibodies versus those that do not, can you tell us about that?
Okay, I lost the last part, but I think yes, I believe that it quickens. I'm sorry. So I think it definitely not only helps the patient feel better quicker and recover quicker and get back to normal life quicker. I'm not 100% that it decreases the prevalence of post-COVID syndrome, if you will. I just don't know the answer. I don't know if anybody really knows the answers because the monoclonal antibody hasn't really been out for that long. So I certainly can't speak to the fact that it will quicken the resolution of the infection. It'll make patients feel better quicker. They'll get back to normal life quicker. But in regards to the long-term effects and post-COVID syndrome, if you will, I don't know if anybody really knows the answer to that.
All righty. Having a few technical difficulties there, but I hear you. So there are criteria for getting the monoclonal antibody. Commissioner Myers, to your, and I was just kind of letting your internet kind of get back on track, Dr. Smith. Commissioner Myers, you mentioned that at the 8008 location, for your district's monoclonal antibody site. How should those people wanting that therapy present? You said they needed a note or an order from their healthcare provider. Who's there to verify those things? Could someone just come in with a positive COVID case from, an urgent care center, if that's where they got there, or CVS, if they got a positive test from CVS, could that provider recommendation be enough?
No, they have to go to their doctor and come in and then register to come into the facility.
What if they don't have a doctor?
Well, let me say this, Hillsborough County government, you can, if they qualify, can register on our healthcare plan, but that's one of the criteria. It's just not for the walk-up individual to come to that site. You have to go through your physician. That's the way it is set up.
Oh, wow. Okay. So do you have people from other areas beyond District 3, utilizing the site? What does a day's infusion process look like? Who's coming to?
Anyone in Hillsborough County can go to that site. That is a county site. It just happened to be located in District 3. But you can come from Riverview, you can come from Odessa, as long as you're living in Hillsborough County, to come to that particular site to be treated. That's the good part about it.
Okay, awesome. And we'll get some information up to our listeners so that they'll know where to go to sign up for this. And I appreciate that information. So we got about 10 minutes left, in the show. And I so appreciate each of you coming on. Commissioner Myers, I know that you're also a big advocate for transportation. And we should be able to get some good information from you on how we can get to those sites, how we can get to some treatment areas, how we can, get to a healthcare provider. Talk to us about what methods or avenues of transportation do we have to help us in this fight to eradicate.
And that's an excellent question, because we have 4 COVID testing sites in the county. All that were hard, the bus line runs right by, so there's no excuse. If you need to catch the bus, it's in walking distance if you live in East Tampa. But let me just take a few minutes to run where these sites are located, where you can go get and be tested for the COVID. We have one in Palm River at the Community Center, 725 South 58th Street. 1101 East 139th Avenue, that's the county's code enforcement complex. At Albert Al Bonds Park, 2902 North 32nd Street, that's in East Tampa. And at Al Lopez Park, 4602 North Himes Avenue. So we have them like in every 4 corners of the county for someone to go. And I live a block from Al Bonds Park. And I tell you, the line, when I came in about maybe 10 minutes to 12, it is around the park where people that really want to be tested, they're in line right now wanting to take the test to see if they have the COVID.
So there's you can be tested, you can get there easily. If there is a pass or any county resources for people that want and they don't have any money for a bus, that they want to go, but they don't have any money for a bus, let us know that information and we can post that up post-show also. So as we're getting closer to the end of the show, I would last want to give Dr. Smith an opportunity to tell us about mutations. Any tips that he has to, stoke motivation towards vaccination. We want him to provide those things, and any closing points.
Well, I certainly wish I was a virologist and I could give you the exact reasons why things mutate. But should we expect more mutations? Yes. Do we have more variants out there? Yeah, we do. I mean, we have there's variances in South America and Europe that we don't have, Gamma, Epsilon. So should we expect, again, I don't know exactly how it mutates, but should we expect more? Absolutely. And I think that really drives home the importance of vaccinations, because we know that vaccinations are helpful even against the different variances and mutations of the virus. So should we expect more variants? Absolutely. But I think the vaccines are going to help safeguard all of this, all of us from these different mutations of the virus. So again, and to your point, Dr. Davis, I mean, we need to vaccinate. I'm a big proponent of vaccinations. We know vaccinations work, and I advocate and really plead with the public to really consider these vaccinations, because it saves lives. The bottom line, it saves lives. And if we all want to go back to where we were in 2018 and 2019, we need mass vaccination. I'm happy Hillsborough County is offering a vaccine.
I think there was a little bit of a technical or internet drag there. But the reason I asked that question, not to get too deep into the science, because this is a community show, but sometimes when I'm asked about the variant, or if I need to get a vaccine from a patient, because people are getting the virus anyway, I sometimes talk about how overprescribing antibiotics has led to resistant strains of certain infections, and why standard antibiotics won't do the job anymore. And just wanting to know, how is it that we overcome that, or explain a mutation in a very rudimentary fashion to patients. So I think you've covered that quite well. If we get a vaccine, viruses need a host to keep going, keep growing. Just in principles of survival of the fittest and Darwinism, the virus wants to survive. And if it has somewhere to go, it'll go and mutate. And is that a good explanation, do you think, Dr. Smith?
I think that's part of the reason why viruses will mutate. I think there's spontaneous mutations that really don't have any reason as why it happens. A virologist would be able to tell you more about that. But just like that in our own DNA, sometimes we get spontaneous mutations that we're not quite sure why it happens. So I think there may be a little bit of a Darwinism kind of thing, like you said, you described, but I also think a lot of them happen spontaneously.
Well, that's good to know. For those patients that have been vaccinated, their outcomes, from what I understand, have been better than the outcomes for the persons that have not been vaccinated. So in some, that's the best way forward. As you get ready for your shift, this is Black Business Awareness Month. So I appreciate you and Cheryl as well for coming on the show, imparting some good knowledge to our community, telling us what you see in the emergency room, telling us about these monoclonal antibodies and how, because I really didn't realize it was a subcutaneous way of giving, and that makes it so much easier for community administration. Telling us about all those things. We appreciate you so much. But in closing, tell us your favorite Black business and why.
So there's and it's been a couple of years, probably since before COVID. There's a gentleman who owns a barbecue establishment on MLK, actually close towards the Hard Rock Cafe. And as a matter of fact, I haven't been there in a while. And we were talking about this because we brought it in one night to the emergency department, a 2 to 11 shift, and we had somebody go out there and get it. And for the life of me, I cannot remember the gentleman's name, but it is on MLK, close to the Hard Rock area, and it is 100% the best barbecue I've had in the area. I'm a big, I like Texas barbecue. He is the closest thing to Texas barbecue, and he's a phenomenal man. He's older than stated age. He's kept very young, and he's a great barbecue pit master and a great guy to talk to. So, and if I wish I really could give him a shout out with his company name, the pit name, but I just can't. But he's fantastic.
So barbecue, we got plenty of those, and we so appreciate you coming on. Commissioner Myers, the only barbecue that I know out that way, it's off Hillsborough, Big John's.
Big John, and you have Barbecue King in West Tampa. But let me wrap it up and say thank you. I have a 1:30 county workshop that I must be on, and I need to be logging on in like 1 minute. But let me say thank you for the opportunity for me to join your show today and speak to your audience regarding the COVID, the Delta virus, and what Hillsborough County is doing to make sure that anyone that want to be vaccinated or anyone that want to be tested, we have a site here in Hillsborough County that they can go to. And so Cheryl, contact me after the show later this afternoon. I'd be more than happy to send all of the sites where you can post on your Facebook page so your audience can see it. And again, thank you for having me. Dr. Smith, thanks for being a partner in today's program. So to everyone, thank you. Stay safe, wear your mask, and keep your social distance in place. Have a good evening now.
Thank you so much.
Okay, bye-bye.
Yeah. Absolutely. So thank you again, Dr. Smith. I know that you got a shift to go to. So in our last few minutes, I want to give shouts out to some of our favorite Black businesses. Certainly in healthcare, I am Shanae Davis, and we do Your Best You personalized primary in diabetes specialty care here at 15511 North Florida Avenue. We have to certainly give shouts out to some of our other favorite healthcare providers. And this is an avenue that you can, once you get your positive COVID test, you can go to these doctors and get that order to have the monoclonal antibodies. So want to say hello to Dr. Rosemary Latortu at 30th Street Medical Associates. And that's at 8715 30th Street here in Tampa. We also have Dr. Olayinka Bankole, and he's on Armenia. He's a primary care doctor. He also services the St. Joseph's audience, and I think you know him, Dr. Smith. There is Dr. Faith Felder in the same area, also a primary care doctor. Dr. Jeffrey Starling. He is a urologist, a specialist. We've talked to Dr. Powell. She's in GI in another on another segment where we were doing colon cancer awareness. So these are some of our African American and minority healthcare providers here in the area. African American Business Month is something that we do all for the month of August. And Cheryl usually has the Power of 31, where she lists out 31 different Black businesses on each segment. But if you are not a patron of Black business and are unaware where you can find how to access A-ready resources, there is the DSI Black pages that you should know about. And this is also a company that Cheryl has founded. She has wears many hats, and she has put together this book of businesses where if you need an electrician, if you need a engineer, if you need a healthcare provider, if you need someone to do your yard, some dry cleaning or whatnot, the DSI Black pages is there for your ready resource on where you can find a Black business to meet your needs. So with that said, we want to thank you, Dr. Smith. I know you have to get on to your shift. Did you have any final thoughts for us?
No, I think it was a great episode. I mean, I think we covered a lot of great things. I think the host did a great job, and Commissioner did a great job. But I again, want to drive home to the point, really think about the vaccines. I think this is the way we get back on track. The way we get back to our normal life is through mass vaccinations. And I know there's a lot of hesitancy, but there's a lot of resources and education out there. So please think long and hard about obtaining those vaccines.
Absolutely, absolutely. And also, there was a recommendation that also came out this week, so that if you've been vaccinated, particularly with the mRNA vaccine, that's your Moderna and your Pfizer, if you're 8 months out from being vaccinated, it's been recommended that we get a booster shot also. You can get these vaccines any of your pharmacies, and online you can literally Google where to get a COVID vaccine for Pfizer or Moderna, because if you got Pfizer, you should get the Pfizer booster. If you got Moderna, you should get the Moderna booster. If you got that one shot Johnson & Johnson, this week also it's recommended that versus the 8 months out, that at 6 months, you should consider getting a booster shot with your Johnson & Johnson. I think it's still under, I mean, you can speak to this as well, Dr. Smith. I'm not exactly I'm sure, but if you got a Johnson & Johnson, and this is an adenovirus in these last few minutes here, an adenovirus mode of action into the system, should you consider getting an mRNA? If you got an adenovirus vaccine versus the mRNA vaccine, which would be the Pfizer and Moderna. Should you get a Pfizer Moderna if you had a Johnson & Johnson?
So that's a really good question. I mean, we've discussed more about if you had Pfizer, can you get Moderna booster? If you had Moderna, can you get a Pfizer booster? But I don't know if you can get a booster for the adenoviral Johnson & Johnson. You may have to go through the complete double set, 2 vaccines if you want to go to that. So did that answer your question?
Well, I wasn't exactly sure. I heard literally this morning on the news that if you had Johnson & Johnson as your first shot, they're considering the recommendation for a second Johnson & Johnson. But that was just today. But beforehand, they said, because it's that adenovirus science, get the messenger RNA as your booster. But when that all comes to pass, we can give you that information too, maybe on the next show, because it's also new. That COVID information changes moment by moment. And that's what we do here to keep our community abreast of what to do. Okay, so I appreciate you coming on today. And if you have any other closing points, now is the time to speak to them.
I think we drove it home. Vaccinate. Use your masks when you feel like you need to. Always hand hygiene. Some social distancing. It's all still in play. It really is. So I think we all have to kind of fall back on the things that we did 12 months ago. So let's stay in this fight. Let's get vaccinated and let's get through it.
Absolutely. Wear your mask, wash your hands, vaccinate, stay safe. We appreciate you. And to our audience, we thank you so much for listening into this 4th hour of Let's Talk Business with Cheryl J. Cousseau. And I'm Dr. Davis. I'm sitting in today. We appreciate you so much.
Thank you. Be safe.
By now, we're all aware of the dangers of COVID-19. Like others with existing health issues, cancer patients are at a high risk due to their compromised condition. If you are newly diagnosed with cancer, your care likely can't wait.